So we'll start off with our kinetic tests and then move on from there to the passive mobility tests. Okay, for the assessment of hypomobility, we'll use the kinetic tests to test the active movement. And for this, for some of them anyway, we'll need the patient in standing. So we'll just come around here. And we'll just bring it across a bit that way. Okay, now, if I simply have the patient bend forward, backwards, sideways, I can't see what's happening with the bones. So in order to do that, I'm going to put my thumbs on some surface landmarks and monitor the movement of my thumb. It's no more than an active test, but I'm simply using my thumbs as a monitor of that active movement. There's basically two landmarks we're going to use, the PSIS on either side and the mid-sagittal crest. So here and here. Now, the first test we'll be looking at will be standing flexion. I need to palpate the PSIS on one side, and what's commonly done is to palpate the PSIS on the other side and have the patient bend forward and compare the relative movements on each innominate. More sensitive, though, is to test the movement at this joint. And to do that, I'll put my thumb on the PSIS on this side, and I'll come onto the right side of the sacrum. Maintain good contact with the bone, but not so much you interfere with the movement. And we'll have the patient bend forwards. And you can see that as she does so, we get relative movement between the two sides. Come back again. And bend forwards again. Now this side is showing the normal pattern of movement. Come back again. That is, as she bends forwards again, the sacral thumb moves initially, and then the innominate thumb moves past it. Using the test in this fashion, forwards again, we can assess sacroiliac movement, that is the movement of the sacrum on the ilium, and iliosacral movement, that is the movement of the ilium on the sacrum. And we can tell between the bones on one side whether or not that joint is moving normally or abnormally. Now, if it's moving abnormally, it may or may not indicate that there's a hypomobility. As I say, if you haven't cleared the lumbar spine, a lot of increased tone in the muscle will disrupt this movement. But again, assuming that we've done this, we can look at the joint itself. Okay, that's one test. The other test we can do is standing extension. And for this, I'll palpate the sacrum on either side of the mid-sagittal crest and have the patient bend backwards, and I'll look again at the relative movements of the thumb and see if they're both going through the same excursion. Come back up again, and forwards again. Sorry, backwards. It's a good job the patient knows what I'm doing. And up again. And if I see that one side is coming further down than the other, then I've got a relative increase in extension on that side. We can do the step tests. PSIS, and this time the sagittal crest of the sacrum. And I'll have Beverly lift her right leg up, which is the ipsilateral step test, and I watch for that innominate thumb to move downwards again, which is what happens as that innominate posteriorly rotates. The contralateral step test will have Beverly lift the left leg up as I palpate the right side, and I look for the sacrum to move down now as it's pulled down by that left innominate. And this is the sort of normal movement I'm looking at. Again, if it's hypomobile, then I'm going to see either insufficient movement, or sometimes I'll actually see, just bend your right leg up, that thumb actually hoist up this way. And usually what that indicates is there's an inability of the lumbosacral junction, or L4-5, to side flex and flex. And so in order to overcome that, they actually hitch that side up. In the standing position, we can also look at side flexion of the trunk. Now, for this, I'll palpate the PSIS on this side, the right side again, and the right side of the sacrum, and I'll have Beverly bend to the right for the ipsilateral side flexion test. And as she does so, this is what I should see. That right thumb on the innominate come up as the innominate anteriorly rotates, and the sacral thumb come down as the sacrum side bends to the left. Come back to the middle again, and once more to the right, like so, and back to the middle. And then we'll get Beverly to side bend to the left in the contralateral side flexion test, and we're getting a dysfunctional movement here. We're getting the same movement as when she bent to the right. Let's try the left side. Bend to the right for me, and that's better. So we can see that the innominate thumb on the left is coming backwards as we get posterior rotation of the innominate, and the sacral thumb is going up as we get right side flexion. Once more to the right, and back to the middle. Okay. So these are the tests we can do in standing. The other tests we can do in sitting and lying. Okay, looking at the lying tests, these are basically non-weight bearing tests. Okay, now the other tests we'll be doing in sitting and lying. So if we can get you sitting on the bed there, Beverly. And we're going to do a body torque test. We're going to twist her. Now, as we do this, I'll be palpating the PSIS, and this time the lower corner of the sacrum on the opposite side. Now, from the PSIS, make sure that you drop medially and come onto the upper corner of the sacrum. So we've got now the upper and lower corners diagonally opposite each other. We'll then have Beverly twist to the right. And what we're looking at is this corner, the upper corner, coming backwards and the lower corner going forwards. Come back to the centre again and go right again, which is what should be happening. If we maintain that palpation position and twist it to the left, then we'll see the upper corner going forwards and the bottom corner coming backwards. So the sacrum's undergoing this movement as she turns to the left and this movement as she turns to the right. If we switch the thumbs, we can then do the same to the opposite side. Twist to the right, and we'll see this one moving forward, and twist to the left, and we can see this upper one moving back. So what we need to do here is compare the amount of displacement of each of these corners with each of these movements. And we can determine whether one side is flexing or extending better than the other side. To continue these tests, we shall carry them out in prone lying. Can you lie on your stomach for me, Beverly? For this particular test, we're going to test non-weight bearing flexion and extension. So we're going to palpate the sacral sulci, and this is where a little bit of position testing does come in. We'll come onto the PSIS, drop our thumbs down the sulcus, just roll them into the sulcus and look for the relative depth of each sulcus. Now we've got the one on the right is a little deeper than the one on the left. I can then come back and check the sacral angles inferiorly and see how they're looking. Now, what I'm looking for here is for a twist in the sacrum. So that if I found this left sacral angle was dorsal and this right sulcus was deep, it would suggest to me that the sacrum is twisted to the left. Now, I need to find out whether that twist is due to an inability to flex or an inability to extend. What I can do now is if I palpate in the sulcus and have the patient do a half push-up. Put your hands back for me. A bit more like so. There. And do a half push-up. There. Keep coming. A little more. Get them up as far as they'll go in a half push-up phase. And look to see whether that sulcus gets deeper or shallower as you do it. Come down again. If you find that you're losing this because the muscle's pushing you out, then palpate the sacral angles and get them to do a half push-up. Come up again for me. Okay, and look again to see whether we're increasing or decreasing the posterior position of the posterior angle. So just once more, into the sacral sulcus and push up, or onto the ILA, the inferior lateral angles, and push up, like so. Now, if we find that as we do this, as she extends, we get an increase in that angle, in that sacral sulcus depth, then what it's suggesting is that there's an inability to extend the sacrum. That is, it's a backward torsion. If we find there's no change in the depth or it actually decreases, then it would suggest that it's a forward torsion or an inability to flex. These inferences will be tested out later with passive mobility testing. The other test we can do in this position is prone knee flexion, looking at the ability of the innominate to anteriorly rotate. For this, I'll palpate the PSIS on the left side and the sacral crest. And I'll have the patient just flex the left knee for me. Keep coming. And as she does so, the quadriceps, the rectus femoris, should pull the innominate forwards on this side and back down again. And we'll compare the movement to the other side. Bend the right leg. There. So I'm looking to see that innominate thumb move upwards as an indication of the rotation of the innominate anteriorly. What you'll often see is when this is dysfunctional is that they will either both move together or you'll actually see the sacral thumb move first as she lordoses the spine. Either one of those two findings would suggest that you need to come in and test mobility at this joint. Okay, so these are the active movement tests at the sacroiliac joint. The exact interpretation of them I've included, or my interpretation anyway, I've included in the manual that goes along with these tapes, and it isn't worth rehashing here. But just remember, the purpose of these active movements is to lead you into passive mobility testing.